Hey there, how you doing? My name is Deron Cloud, and this is my lovely wife,
It's Jill.
Jill, and my best friend, Guru, the woman who is smarter than me. And we are welcoming you to the new ministry of health, where God is what?
Truth.
And so we've been doing these kind of outreaches for years. And we first started with calling keeping it real, but right now we say that God is
It's truth.
truth. And the reason we say the new ministry is because new meaning we are asking you to take a look at your health from a new set of eyes with a new perspective. And so our goal is to share. We honestly believe that sharing is caring. And if we share what we have experienced, it can help someone else.
Absolutely.
Oftentimes we keep our experiences to ourselves because we just think they were our experiences, but those experiences are golden and so rich for so many other people.
Oh, really? And a gigantic, enormous example of that was if you were here, or if you listened to any of the other broadcasts, Deron talked about the medication you was on. And he was on a particular blood pressure medication, and it was messing with his head in terms of he was forgetting things, and he was saying if you part of the other meetings we have, you would hear him talk about short-term memory loss and those kind of things. And that was due to the fact that we thought that the cancer medicine that he was on, that was a side effect of the cancer medication. Now remember, I'm still talking about why you should tell your story. Well, what ended up happening is he was talking to his sister one day, and one of his sister's co-workers or colleagues talked about this medication that he was on.
Right.
And then and why he wanted to get off the medication and some of the side effects he had. So that triggered Deron to go and look at the side effects of this medication, this blood pressure medication. Because remember, there's no searching for why you're having short-term memory, because to him, you know, he had cancer that went to the brain, and so his brain, anything that happened to his brain is just relegated to the cancer.
Right.
So then he talks to this guy, or he hears this guy, he talks to his sister, and all the guy said was one thing. He goes, he researches the medication and finds out that the side effect of the medication is forgetfulness.
Right.
He stops taking his medication, and in 1 week, he can recall. Well, guess what? What if that guy never told the story? What if he just never said anything? So that's just how it's so important. And I won't go on any further than that. But I know that then when you told your story about researching medications and how to research them and look at the reviews and don't just look at the side effects, I know at least 5 people who right after that began to tell me, yeah, they prescribed me some medication. But now, instead of just looking at the side effects, I looked at the reviews of the patients and the people using it, and now I can see what was happening to me. I can see the similarities. So then more than a few of them went in and talked to their doctor to say, what else can you do? What else do you have available? So the power that it gave, the empowerment from just telling your story and in the space of somebody that you don't even need to hear what you're saying.
Right.
And that's why I think it's so important in terms of what you were saying.
And you know, when you say that, what we're doing is empowering you with information that we've learned, because as we will continue to talk about it, once I learned what was happening, immediately it just clicked, and I went in and I started asking questions. And this is why we'll be exposing stuff too, because I found out that they switched it because I was on the most expensive one, and this one was the one that wasn't expensive. And so I said, put me on this, and I'll never forget, I went to the drugstore and tried to get it, and they said, we don't have it. It's going to take us 2 to 3 days.
Right, but you know what else happened when they did it? You went in and one of the representatives or workers, employees, whatever she was, she said,
sure
we
did.
just gave you a portion. They said, I'm sorry, we just gave your medication to someone else. I said, there's no way in the world you're going to give my
No,
medication
here's
away.
exactly what I said. You are kidding. You're not telling me that. And I said, she says, well, you had 3, but we only have 1 bottle because we gave the other one. I says, ma'am, what's going to happen is I'm going to drive away from this window with that blood pressure medicine. So do whatever you got to do, and I'll just sit here and wait for you. Because if you don't become your own advocate, this ain't about attitude. This ain't about whatever, because you have to be able to speak up for yourself and say no. And literally, I got what I needed. Now, she was expecting me to get upset. I was like, no, I'm not upset. I just want to make sure I walk away with what I'm supposed to walk away with, because I know that this particular medication protects my heart. And let me tell you what I found out after that. No one told me what you're taking, don't stop immediately. No one told me. But because I was awakened.
Say that again. What he's saying is, what do you mean when you say when you stop?
In other words, no one, I was supposed to taper off. I was not supposed to stop taking this, because if you do, it'll give you a heart attack. So the very thing that was supposed to keep you from having a heart attack will give you a heart attack. But I had to make a decision. No, I'm researching and I'm finding out what's happening. And that's why we are doing the new ministry of health, because we have to make sure that we're going to share our story.
And new is not, as Deron says, opening your eyes, but it's not new.
Right.
Like the New Testament is a new take on the Old Testament. It's not new. You can always understand the New Testament by going back to the Old Testament, because that's where the foundations are. Well, what do we know? We know that there are a whole bunch of things, and Deron, you talked about this in some of the other episodes. There's a whole bunch of things that changed in the healthcare industry when it came to holistic and nutrition and the way things used to be. And remember, you told the story about how many doctors, how many schools they had that were teaching medicine, and then how many schools, how it changed when they decided to take that out. Well, guess what? Now that we're in a place where those kind of helps, they're available to us now.
Let me just say this real quick. What you're saying is that at one point there was almost 7,500 medical schools, colleges, and they passed a bill to outlaw holistic medication, natural medication, and they turned the entire medical industry from holistic and allopathic and all these good care just to pharmaceutical. And the pharmaceutical companies funded it and got on the boards of the hospital. And when they got on the boards, the boards of the schools, that meant the school had to change their curriculum. And this is why many of us know more nutrition than the doctors that we go to. In fact, ever since I've been on this journey, not one hospital or doctor has asked me, what is your diet? What is your nutrition? And what are you eating? All they want to check is your liver working, and is this happening, and what are your enzymes? But they don't ask you what's happening, and that's why this is the new ministry of health. The 10 Commandments, we've already established 3. Commandment number 1, we take it from 1 Corinthians 6. It says, you were bought with the price. Therefore, glorify God in your body, in your spirit. And so we believe in the spirit. And we also believe that, remember, you were bought with a price. And so when you do that, you glorify God in your body. Then commandment number 2 was, thou shalt have a merry heart, taken from a proverb. A happy heart is good medicine, and a joyful mind causes healing, but a broken spirit dries bones. And so in that being a commandment, then it's for you to be happy, and we'll keep going with that. The 3rd commandment is that thou shalt not use food as your comforter. See, when food becomes a source of being a comforter for your emotions, but not a healer for what you're going through physically and all of those different things, then you are going against yourself. And so we are now going to enter into a space, babes. Wait, do you have anything you want to say about
I was just going to say on that last particular one, you talked about food being a comforter. What's important is that while we're doing this is because we want you to get to the point where your comforter is the truth. Now, we know, we read that all the time, that the Spirit of God is, and the Holy Spirit is a comforter, and is also the Spirit of truth. And so when you substitute or you medicate with food or anything else you decide to medicate with, you stay further and further away from your truth. And when you are not actually looking at the truth and dealing in reality, then you find solutions and ways to help yourself or to heal yourself that are very temporary. Right. Because if you're going to search for a solution, you can only really search for the right solution if you're honest about what the problem is. Right. And that's why truth is so important. And that's why food cannot be our comforter, because food will not change what we're going through if that is not what we really need.
Right. And not only that, Jill, we are supposed to be healed from the seeds of the earth. Plants are healing. And I always tell people, remember we used to go walking, and when we would walk, my heart would begin to hurt. And I didn't know what it was, and I found out it was angina. And so I would have to hold my hands up while we were walking just so I could breathe, and the pain would go away. And then I realized, wait a minute, something's happening. And I said, I want to be changed, but I do not want to have to be put on certain meds. And that's when I studied and found out a plant-based diet would reverse it. And that you could reverse this by getting on a plant-based diet. And when I found that out, that was a eye-opener, because I was a steak and potatoes man. And I was like, this ain't happening. But I was like, do you want to live?
And I'm telling you, Deron, this is why this person here, he is our family guinea. He's the guinea. He is going to search it, and he's going to try it. That way I can try it after I know it works. Really, remember you did this thing for gallstones?
Oh, yeah.
I don't believe it.
Hey, but listen, they're gone.
They were gone.
I literally, and I'm not telling you how to do it, but I literally was able to remove my gallstones with applesauce and olive oil. And if that's all I'll tell you with that. But I was able to pass them, and ended up having to pass them. And there were several other people I told about it, and they too ended up not having to have surgery, because you can pass them with applesauce, apple juice, and olive oil. But I'll spare those details. We'll talk about that later, because I don't want to get into that.
I'm just talking about why it's important to have somebody in the family who's going to try this stuff for real. So this is why I'm such a believer in what he's saying.
And medical food products.
Medical food products, because really, Deron would try those things, and then I could kind of come in and say, okay, well, he's lived, he survived, and now I could try it.
That's it. And so that was my story with. That's how we got into this new ministry of health. I think we've exhausted in just the intro.
Yeah.
Let's take a break. We're going to take a break, and we're going to come right back, and we're going to pick up with one of the subjects that I think is very dear to what we're doing and what we're talking about.
Sounds good to me.
We'll be right back. Back. We just had a very good discussion, Jill, just talking about what the new ministry of health is. One of the things that I'd like to talk about now is my medical records online. MMRO. You haven't heard of it as of yet because it has not hit the market yet. But I want to talk about my medical records online because it's a lifesaver. And if you're a patient and if you're a caregiver, if you are someone who has to deal with someone, or an elderly parent or a child, or someone, or you have to go to the doctors for yourself or with your family or whatever the case may be, my medical records online is a tool that will be able to help you. Jill, when I say we talk, and so I want to talk about it, and so we'll go through it. And I want to bring up the slides if I can, because I have a couple of slides I'd like to read. Okay. And then as we read, and if you want to make a comment on it, you sure can. But I just want to establish what my medical records online is and why it's important and why you would even hear me talking about this, because it's a lifesaver. That's all I have to say. So I'm going to push play, and you guys tell me if you're ready, and we'll go from here. There you go. If you haven't noticed, our current medical system is broken, and it has failing those us. What does it say?
If you haven't noticed, Doc.
Protect and accommodate. And so keep going. We are supposed to have access and what, you all? Control. You can bring that down. As a patient, you must have control over your records. I didn't know this. And so every time I went to the hospital, every time I went to the doctors, I signed out all these papers, and I didn't know that I was supposed to have access and control, and that I was supposed to be afforded the privacy and the right to control my medical records. But the system, I found out, made it virtually impossible, because it got to a point that I was lugging big folders and stuff, because when I went to go get them printed, they were big like this. And so then I was losing it, trying to figure out, how am I going to keep up with these records? The purpose of my medical records online, and I ask you just to listen to what we're saying, is to give, and you can bring that up, to give patients control over their medical records. And what do we mean by that? Give you control. There have been numerous attempts over the years to empower patients and allow us to have access to our medical records. And all previous efforts have failed. You can bring it down. Listen. I didn't even understand, babes, that you could feel like John Q. If anybody ever seen that movie with Denzel Washington, I have yet to be able to bring myself to look at it again, because I had my John Q moments when it came to my medical records and what was going on in this medical system. And that day that I was sitting on that couch and they told me that my copay was going to be, first it was $7,000 a month, and I didn't know what to do. And I said, what am I going to do? And I had no one to talk to. There was no one to go to. And so it's failed. And listen, doctors spend less time with patients and more time dealing with administrative issues. When here I am trying to figure out, I'm having the worst headache of my life. I'm having to be assisted to go upstairs, assisted to get out of the car. And I go to a reputable hospital, believing, okay, because of this name of this hospital, I'm going to get good care. I come in. By the time I go to see the doctor, she said, you were 10 minutes late. I said, ma'am, I'm just trying to, what is your problem? And before you know it, she started asking all these questions. And I said, man, let me ask you a question. Are you in a hurry? And I said, because I can go ahead and come back. And she says, no, you won't be able to because it'll take another 4 to 14 weeks for the other appointment. I said, well, then I'm just have to take my chances. I said, listen, you have a good day. And I said, hey, know this, my daughter's a doctor, so I know what you're doing. And then I got ready to get up. Sir, no, sir. I said, are we going to be able to have a conversation? And then she started switching up. I got to raise that kind of energy, and I'm sick. Then she prescribes me some medications after asking me 3 questions. And I walk out and I call my wife, and I'm sitting there waiting for my friend to come pick me up because I can barely walk. And Jill says, don't you take them medications, remember that?
Yeah, and I told you I was bothered that you even let the lady see you. You know, it was one of the moments I thought I needed to take my rings off. Where's she live? You know, it was awful. It was awful. It was awful to be done to anybody, even if somebody wasn't as ill as he was. But as ill as he was, as obvious as that was, you would think that someone would find kindness in that. And it just wasn't there. It was awful to me.
So the healthcare system has become a game. And so when we're talking about this, it's become a game. We're believing that we're being helped, but it's all about the funds.
And the pressure is on them. See, for those in this room who know me, my daughter is a pediatrician. So I know that in her case, you know, I know that doctors get rushed. And because she's a pediatrician, it's very different with children. Children don't want to leave. Children don't give you information, you know, that fast. They don't rapidly share all of what they know. It takes a minute to get them, especially when it's a teenager and somebody's coming in. Then they have those kind of parents that they can't talk around because they can't share in front of their parents what's really going on. And you still have to try to do that in 15 to 20 minutes in order to satisfy, I don't know, who are they trying to satisfy? Who's the insurance companies?
Mm-hmm. Well, watch this. Let's talk about that. I didn't learn this because my daughter kept saying, listen, doctors, it gets to a point, they get so tired of wanting to be sued. They don't know what to do. Bring that next one up. Listen, more money is being spent on legal issues with doctors and hospitals than the total revenue taken in by hospitals annually. Did y'all hear me? More money is being spent in the court on legal defense issues and legal lawsuits and malpractices than the hospital brings in per year money. The only people making the money are the lawyers.
And when you see it from that perspective, if the money, because of My Medical Records Online, if my Medical Records Online will help us organize this from a personal level, well, that means once the companies save money, then that means that means there's more money to go out into the community to do some other things. Right. Does that make sense to you? Because there's money left over that's not, I'm going to use the word wasted, on a whole bunch of error. And there's a whole bunch of error out there.
And I'm glad you said that. As we began to get involved with this company that's coming out real soon, it's going to save the medical industry $450 billion a year. Did y'all hear me? Because they're going to take the burden of the hospital having to keep their own records and all those administrative fees away from them. And the hospital is going to farm out somebody like I'm just using an example, LifeLock or something that is super secured so that they don't lose money because they're losing money. Are y'all following me?
And listen, just imagine how medical error will be reduced because no one will be prescribing the wrong medications to you because you have your records. Oftentimes, the problem is your records are with 4 or 5, especially if you've had a series of illnesses, your records are with 5 different doctors. What happens if you can't get them all on the phone? What happens if one goes on vacation and you can get 4? And that's the one that has the information about you that the hospital needs to know whether or not they should prescribe something to you. And so just imagine the stress, because we're talking about the industry, but Deron is going to get to it, I'm sure.
Well, let me just
but
give
think
the
about the stress
statistics.
go ahead.
I said, let me get the statistics.
Okay.
3 of every 10 tests, 33% are reordered because the results cannot be found. This is what we don't know. Patients' charts cannot be found 30% of the time. Providers need to fill out an average of 20,000 forms every year. The average organization spends about $20 in labor to file each paper document. 80% of all serious medical errors involve miscommunication during transitions to different care settings. Missed appointments cost the U.S. healthcare system more than $150 billion a year. Approximately 1/4, 25% of U.S. patients reported that the results of the records from the provider did not reach the other provider in time for their appointment. 1 in 5, 20% malpractice claims involve missed and delayed diagnosis due to the deficits in the handoffs between the providers. I'm just thinking about the day I found out that I had something serious going on is when I went to that pain management person because I couldn't get the headache, and they prescribed me 190 tablets of Oxy. And I said, I'm not going to mask this. And I called my friend and I called my sister, and she said, go straight to the emergency room. And that's when I end up, where did I get that? What do you call that thing?
The spinal,
A spinal tap. I ended up having to get a spinal tap. My friend was here. I had to call her on the way to say, hey, listen, they telling me I got to get a spinal tap. Have you ever done this before? And I called somebody else. She said, and I'm finding this all out while I'm on the way. But because I got there, that's how we find out. And so when you say that, Jill, we don't know these things about this, and there's a patient's bill of rights that is supposed to protect us, but it doesn't. And so I wasn't hip about HIPAA. I wasn't hip about what HIPAA was about in terms of, we hear about it, the Health Insurance Portability Accountability Act. It's the government regulations for medical information. And so I wasn't hip on HIPAA. And so I kept saying, why do I keep having to sign all these papers every time I go in, or push all these different things? Well, you hear us say it every time we come on to talk about the new Ministry of Health, is because, to be perfectly honest, we don't know what's in our medical records. We have no idea what's in our medical records. The information that's in your medical records, and you can bring it up because somebody may want to copy this down if they watch this later on. But the information that's in your medical records, basic demographic data, address, phone numbers, email address, age, gender, and race, full name and account numbers, and sometimes social security numbers, medical history, diagnosis, treatments, diagnostic test results, and the prescriptions, along with known medical conditions, allergies, drugs, alcohol, smoking habits, billing and payment information, information about your immediate family members, including any history of certain diseases like cancer or diabetes, who may have access to my medical information. This is why I have such a passion, because here I am every time filling these forms out, thinking it's to save my life. And they're now saying what information, who gets this information. Life insurance goes to this. They get to sell it to life insurance people, car insurance people. When you go to buy a car and you want to get your car insurance, they go to check your credit. They're also checking your medical records. Employees get to it. Pharmacy benefit managers get to it. Government agencies, Social Security, disability. Listen, car dealerships. And when I found this out, I said, no, the truth has to be told. Because here I am trying to get better, and I'm playing games. and then being told that it's psychosomatic.
Yeah, that was sad too.
I'm being told this is psychosomatic, and I'm saying, listen, I'm not a person of drama, sir.
Well, that's not true, but anyway. But he wasn't drunk. He wasn't being dramatic about that.
Say it again. Okay. There you go. And so these people get this information, and the solution became My Medical Records Online. Why? Because MMRO has developed a medical record portal system that uses diagnosis codes that trigger instant extraction of all your medical information and data from past to present. You can bring it down. Listen, it was good for me to be afflicted. I believe it, because it put me on the path to bring healing to millions. Why? Because God knew that my experience and her experience with this system, we would speak truth, and we would not be afraid to become advocates for the truth, so that no one would experience what we've experienced.
Absolutely, although the health issues were with Deron, as a caregiver, it was very difficult on my side, and especially when when he was in the hospital after he had the spinal tap, which is also on your birthday, I believe. Mm-hmm. And one of the things that was very difficult is that he probably had at least 10 different doctors from 10 different areas, and each one would come in and he would have to tell the story all over again. And at some point now, I am in the room telling the doctor, listen here, listen, come in here, just tell him what you have to say. He's not telling his story. She says, oh, no. He's not going to have to tell the story again.
Didn't start.
And in 2 seconds, she started asking those questions. Guess what happened? I said, you have to leave. You got to leave. We can't do this, because what was happening is his blood pressure kept going up, because every time they came in and had to make him relive one of the most scariest moments of both of our lives, I'm sure, and every time they came in with that, then they'll leave, and then we'll kind of sit in the room and kind of talk about good things and positive things and try to bring him back to a place where he's not stressed out. And 10 minutes later, somebody else walked in the room. It was probably at least 9 different doctors that did that.
Yeah.
And finally, what the good thing is that because my daughter is a pediatrician, we talked to her, and she gave us some terminology.
Right.
And she said, say this to them. And whatever that terminology is, and I'll get it the next time, what they would have to do, what it was going to tell them to do is, you all designate one doctor, and you all stand in the hallway if that's what you have to do.
Right.
And you give that one doctor the information that needs to be shared with us. But you're not going to come in.
And let me give you a tip. I'm glad you said, let me give you a tip. I found out when you go to a university school, you're going to a teaching school.
Teaching hospital.
And a teaching hospital. And so each person that's coming in, they're learning. And so that's why they asked you the questions. Because the first day the first day me and Joe started there to get the spinal tap. Mm-hmm. Don't even know I'm getting ready to get a spinal tap. Mm-hmm. Then some guy comes in with some card and says, yeah, and so we have this test and we want to go ahead and do whatever. And I said, well, what does that have to do with what I'm doing? Well, I mean, we're going to do that. And then he said something to try to make me afraid. I said, sir, I know my hair is all over my head and I may look crazy, but get out of here. And he says, well, what I said, get out of here.
And you asked him too.
I asked him twice.
If so-and-so, the doctor that was really treating you, asked him, did this doctor tell you to say this to me?
Yes.
And because he came in as if he was coming after someone and he was continuing on with a previous conversation. No, he was in there trying to sound smart. Really, it was extra stuff, but it was fear-based.
And I asked for the head of the emergency room, right. And I looked because it was glass, and I said, sir, can you come here? And it wasn't with attitude. Listen, let me tell you who survives. Those who don't go along with the system. Those who ask questions. That's who survives.
Mm-hmm.
You're going to give me a test? Tell me what the side effects are. Now, you can do it very nice, but you don't have to go along. But if you just go along and you're not asking questions and being an advocate, and I'm not telling you to be a very bad person about this, I'm just saying you have to be an advocate for yourself. But also respect the profession, because I did as much as I could to respect until I realized when I asked the man, they were trying to get me to do radiation, and I didn't realize that they were jockeying on who was going to get me. They were jockeying on which person was going to be able to perform on me.
And why was it important for him to advocate for himself? Because had they done radiation on his brain, it would have sent him into premature
Dementia.
dementia.
And I asked them, what is this? And they said, well, you need to do it because it's preventative. And my mom, she came in there and I said, Ma, I feel like they're putting all this pressure on me.
She said, if you don't feel it, don't do it. Don't do it.
She said, if you don't feel it, don't do it. And I said, Mom, I'm not doing that. And so when I asked the man, can I go and use some medical food products and do some other things if you want to die? That's what the surgeon said to me. This is why y'all see this passion. Because I had to fight to be here. I had to fight because I didn't know. Didn't know that was going to happen.
There you go.
So I'm going to go ahead while I'm here, because I'm going to take advantage of this moment. And the next thing on here was the letter. And then once I do that, we'll move on to the next subject. But I need to do this because I had a My Medical Records breakthrough. And today was the first day that I read the letter since I wrote it. You don't have to bring this up, but since I wrote it, but I'm just going to give you some highlights. I wrote it when I realized that God had put this in my lap and put this in our laps. Mm-hmm. And I wrote it to the people who own the company and the people who were doing it, because they said, Deron, this is about legacy and we're trying to help the little man. And they were for real.
And can I say this before I turn it over? There's a team of us. You're just listening to the two of us.
Yes.
There's a team of us. There's an emergency room doctor. There are teams, people in different professions with different experiences, because we all believe that you deserve to feel better. Right. You do. You deserve to feel better. And someone needs to let you know how to get there. Right.
That's why and we're running it now. Dr. Henry Lamont, he's over every emergency room in the United States. And he's responsible for what we'll talk about as we keep going. But let me just give you a couple of highlights on what this journey of wellness is. And I said, I finally understand. I'm either going to be a victim or I'm going to be empowered. And I've had to decide, as much as I hate the victim mentality, I had to be awakened. And the reason I had to be awakened is because I was looking at everything through a veil of fear, because this healthcare system is a no man's land. One must be present and aware. One must be fearless. And one must be fearless in the face of adversity, hard decisions, mental, physical, and spiritual circumstances that never seem to end. So I want you all to hear when I say why I am an advocate for your health and the new ministry of health and you being able to get control of your health. And because one must be fully present with their issue and their loved one's issue. And My Medical Records Online will assist you in this process by helping the patient keep it together. Now, I wrote this while I'm having the worst side effects of my medication, but I was awakened at 3 o'clock in the morning and was told to write this. and it says with professionals that will help you navigate the journey. But when I said keep it together, when you are ill, when you are in pain, and when you are suffering, you got to do everything you can to do what? Keep it what? Together, because you want to lose it. You want to throw in the towel. Or if you have a loved one who is going through something and you can't control, you're trying to do everything mentally to keep it to what? Gather.
Let me say this
Go
before
ahead.
you, and remember this, you already know this. When you're anxious, you don't make your best decisions.
That's it.
And this is what we're trying to help you prevent, so that if you keep it together, you at least make an informed decision.
And so then it's a health, where I like my medical records online, is the health concierge portion of the portal, of the medical portal, where I'll get to talk to, you get to talk to doctors. They get to tell you if there's complications in the medication. They have algorithms that if they prescribe the wrong thing and there's a cross in that medication, then guess what's going to happen? It's going to flag and say you can't have it. And what I really like about it, that it's on your phone, in your hand, and you own the code. And so when the doctors ask you for your records, you can give it to them right then and there. But then they get to look at it. But it's so hooked into their system that it only stays for a certain amount of time, and then it disappears. Why? Because they don't get an opportunity to copy or sell your records. And they are hooked up into all three major record industries in the world. So any place in the world, you can have access to your records.
How many of you, to be honest, you can do this by the show of hands, when you're taking medication and you know that you have to take 2 of them, that you have that scary moment as to, can I really take these 2 things together?
Yes.
Listen, I do that with, can I take Tylenol and Advil? I mean, it's not even prescription. And I start getting nervous about it.
Right.
Again, what do I have in my favor? My daughter is a pediatrician, and I have friends who I can call. Well, guess what? Some people out there, you don't have those friends, but this is what my medical records online will do for you because of that concierge service. If you don't have a friend that's a doctor that you could just call, and your own physician isn't available, the concierge service will be able to answer those questions for you. And again, what were we talking about? The stress that will no longer be in your home, because when you are stressed, your children get stressed. When your children get stressed, your community gets stressed, because they take their stress and their frustration and anger from all that stress to school. And before you know it, we have some kind of a system at school or problems at school, all because stress.
That's it. And listen, I'm going to finish just a little piece of it, and then we're going to take one more break, and then I want to get to the guests that we have to talk about some other great things that are going on. When you say stress, all I want to say, guys, is that this experience was confusing and frustrating. And if you've ever been through if you've ever been through the gauntlet of trying to find your records and having to call the hospital, and then them give you this number, and then you get this number, and then they put you on hold, and then you call these people, and then they're at lunch, and then you got to call back, but then you miss it, and you got to call the next day, and then they tell you we have it, but then you got to drive to the hospital because you got to pay for them to have them printed, and then when you get there, you forget to ask what you were supposed to do, and they could have given it to you on a DVD. And they said, well, we will give it to you, but you would have had to tell us that you wanted a DVD, so we can only give you copies. This is all while you're going through.
Do you know I went to get my records one time with Deron? They told me, I said, well, can you give me my blood type? They said, no. I said, you have to know my blood type. They said, we can't give it to you. You have to fill out some other forms. I couldn't believe that. Has that ever happened to you? I couldn't believe that.
There you go. And so I've immersed myself into this journey. We will come back at another time and really deal with this. Tonight is about paying it forward. And let me tell you what I mean by paying it forward. See, you're going to hear this information and you're going to tell somebody. You're going to hear this information, and I'm talking about you're going to hear some of the wisdom that we're sharing and what we're doing in terms of what's happening, and you're going to wake up to what's going on with you, and you're going to become empowered to do what needs to be done. And so that was my take on why I like my medical records online. And if you want information on that, log on to what should they log on to?
You want ours?
Yeah, yeah.
Okay, you can go to Medical Foods Cafe.
No, I thought for the soldiers, I don't understand what was it in terms of getting their information. We want to send them information
Okay,
for my
you're
medical
right,
records,
right. Go to
right.
Soldiers Outreach, and then you'll be able to do that. Go to Soldiers Outreach, and then you will be able to see on the menu, I think it's Pay It Forward. And then once you go to that page, you'll see more than a few things. And then at the bottom, it will ask you to give your information if you wanted to have more information about my
When it
medical
comes
records
out.
online. But also, if you don't want to do that, when you leave outside, there will be a hard copy of a form you can fill.
Right.
And we can take it that way too. If you're present, you can do it that way, okay?
Okay. And so listen, we're gonna take one more break, and then I enjoy talking about that, but now I get to talk about what has brought my cognitive function back, what has brought me back to life, and I'm really looking forward to talking about this on the next segment. Thank you for joining with us. We're gonna take a moment, and we're gonna come right back, and because my mommy gave me permission. Talk to you soon.